Thank you, Dr. Syed, Dr. Othman, and Dr. Gilbert for joining me today to talk about the awful situation in Gaza. I'm wondering perhaps if we can start off with you, Dr. Syed. I understand that you're seeing a disturbing number of cases of hypothermia and deaths as well. Perhaps, yes, you can begin by speaking to that and also the proximity. Um, you have right now to the Kamal Adwan Hospital and what you're seeing or hearing about there.
Yeah, thanks for having me. So we are seeing quite a few deaths. We had the fourth baby die of hypothermia from being in a tent overnight. This is, obviously it's a result of malnutrition, poor living conditions, but also babies who are already at risk for dying of hypothermia. There's absolutely no insulation, and I'm sure most people know that there are no building materials allowed inside. So even if people wanted to make a more adequate living space, they're not able to. So these are scraps of paper, of cardboard, anything they can find to make these tents. And obviously, it's not a suitable condition for a baby under any circumstance. We also had a nurse. I got word that there was a nurse that passed away as well overnight from hypothermia. So I think in the coming days, there's going to be more and more deaths due to hypothermia. But again, this is not just singular hypothermia. This is hypothermia on top of everything of malnutrition, sepsis. One of the babies that died was actually in septic shock. And as we know, septic shock and hypothermia, they go together. So definitely for baby who's at risk already. So yeah, absolutely. And that's just the tip of the iceberg for things that we're showing.
Yes. And primarily the victims you are seeing are children, women. Is that right?
It's disproportionately so women and children. I mean, children need a certain type of nutrition. They need certain nutrients to grow and develop. I was working in the pediatric emergency department, and I met a mom who was feeding her baby, a newborn baby, sugar water because they couldn't afford the formula, and she can't produce breast milk because she doesn't have enough nutrition to produce breast milk. And she can't, like I said, she can't afford the formula. And even if people can afford the formula, it's not available in the market. So people's hands are tied, and no matter which way, even as healthcare workers, we feel completely helpless, completely, hopeless about what we can do. There's only so much we can do.
Yes. And we're also hearing, of course, about the attacks on healthcare workers at Kamal Adwan Hospital. And I understand you have some insight into what's happening there. Perhaps you can share that as well, Dr. Syed.
Yeah, so they have arrested and abducted and abused the director of the hospital. We now know that that's just common in public knowledge now. The patients and the staff were forced to undress and forcefully evacuate the hospital in the cold weather. Some of these patients, just to remind you, some of these patients are receiving life-saving care. They're attached to medical equipment, IVs, things that they need to recover, and now they have to resort to being on the street in the cold. Some were actually evacuated to Nasser Hospital, but we also expect to see an influx coming into Central and Deir below where we are right now.
Mhm. So thank you, Dr. Syed. I'm wondering, Dr. Othman, if you can comment on the kinds of surgery that this kind of horrific violence has caused you or that requires you to undertake.
Thanks for having us on. I mean, it's beyond understandable how the attacks are still ongoing against the civilian population. So while we've been here in the last 3 weeks, there were attacks on the central the marketplace area where a number of people, including a young man, had most of their legs auto amputated. We've got a young 23-year-old lady who's lost her right leg and her left eye, as well as her 1-year-old child in those attacks. Shrapnel injuries from these explosions cause all kinds of devastating limb, trunk, as well as abdominal injuries. So sometimes they are deadly, and sometimes we get to them in time that we can perform life-saving procedures, even though often they're not necessarily limb-saving procedures. But the worst of it is that even if you can get to a patient in time, the intensive care is massively overcrowded. Sometimes you've got a patient who you know you should send to the intensive care to be looked after, and you can't. So they're extubated, the breathing tube is pulled out afterwards and they're sent to the ward with the hope that they'll just be able to make it through. And a large portion of injuries happen to the young children. So those in their late teen years or those sort of 14, 15-year-olds, which, as you can imagine, this is particularly traumatic, not only for them, but also for their families and for the healthcare workers to witness. And more often than not, we're seeing continued attacks on there are. So every day or every day, there's ongoing attacks there that are coming into the hospital here. And the hospital facilities are beyond stretched. So
Yes.
even when we can do what we can, even caring for wounds, there's not enough gauze, there's not enough antibiotics, there's certainly no good analgesia to give to patients to be able to care for them afterwards. They're barely getting any good nutrition. So eggs has only just now come into Gaza in the last couple of weeks. Other than that, there's no real other good sources of protein because there's still no real meat or chicken. And prices are extraordinarily high. And in this winter season, not only with the hypothermia, but with malnutrition and poor healthcare facilities being under-resourced, it's going to lead to many more deaths that are preventable.
Yes. Dr. Othman, are you able to speak to how quickly or the frequency at which the victims are being brought to the hospital?
This is one big contentious area because sometimes in the area that attacks happen, the ambulance staff aren't able to actually physically reach them. So either they're being prevented or their physical inability to take them, through certain roads. There are a few other hospitals around Al-Aqsa Hospital, so sometimes patients are transferred there first. But if they're critically ill or require certain subspecialties, they need to come here to Al-Aqsa. So as you can imagine, those who might need an operation quite quickly when they first go then need to get transferred to another hospital. And that delay also causes worse prognosis. And so sometimes we receive numerous patients who are on the cusp of death and it's too late for us to intervene. And more often than not, there's always people that have died during the attacks that are either brought here or to the other facilities. And we just have to do what we can.
Okay. So, Dr. Gilbert, I want to ask you, as someone who's spent so many years serving in Gaza, what your take is on the response of the international community. Has it been improving? Has there been change? What's missing?
It's a shame. It's a total shame. It's a moral breakdown in the West. Or rather, it is another confirmation that we still have colonial powers who wants to grab land and kill indigenous people. That's what we're seeing in Gaza and in the West Bank. So this support for Israel from the European governments, from the UK, from the US, Canada, New Zealand, Australia, all the old settler colonial nations, it is a complete moral breakdown because they allow in full daylight a genocide and an ethnic cleansing to be going on for more than 14 months, targeting 2.2 million people in Gaza. And I won't even list the number of violations of international law this is. The problem is that Israel is allowed to do whatever they want to do. And they have been enjoying this impunity for 75 years. And this is what you get. This is what you get when you don't control a fascist power with weapons. So all the things that we doctors are talking about are 100% man-made, are 100% avoidable, and all the deaths in Gaza are avoidable death, as we call them in medical terms. As for these horrible hypothermic killings of the children and this one nurse, it's 100% man-made. It's very easy to prevent. I live in the cold part of the world, and I can see my two brave colleagues are dressed like we are in winter with big dough jackets. It's very easy to prevent hypothermia. But when you have robbed people, and let me remind you that I think it's almost 90% of the living houses, the houses that people live in, are destroyed in Gaza, and you are forced to live in tent. And the night temperature drops down to, I just checked it, 7 to 8 to 9 centigrades, and there is rain and there is wind. This is a recipe for very rapid cooling down. And when you're malnourished and you're small, or if you're pregnant, you're extremely vulnerable to hypothermia. I think that what the propaganda machinery is trying to lure us into is to discuss a lot of details about the medical problems, whereas we lose the root cause. And as doctors, we are trained to look for root causes and not only to treat symptoms. And the root cause of all the things that we can describe, and my brave colleagues can describe from Gaza, it's the occupation of Palestine. It is the colonization of Palestine. It's the 17 years of siege of Gaza. So when people in Gaza are meeting cold weather, they are not dressed for it. Why? Because they're stupid? No. Because 70% of the people of Gaza are poor, by definition, as a result of the siege. And when you're poor, you can't afford woolen clothes. You have very cheap, plastic clothes. And when you live in a tent, the tent sheets are so thin they cannot prevent the cold from entering into the tent. Another aspect of that is that while people were residing in houses, maybe sheltering with relatives or in other commodities where they could shelter in-house, the number of traumas following Israeli bombing was lower than now, because now the shrapnels that can travel hundreds of meters easily penetrate the tent textile fabric and enter into the body and cause often deadly harm. So my answer to what the Western response has been, it is very depressing, it's very shameful, but it's not unexpected, because we are facing a new colonial time, a new colonial era, and Israel and the occupation of Palestine and the attacks on Gaza is a test tube. And this is what we will all have to expect if we don't stand up against it. So let us, rather than focusing on the betrayal of the Western government, let's focus on the bravery of the global South, and in particular, the Republic of South Africa, who has been standing tall and taking Israel to the International Court of Justice and to ICC. So we need to follow this legal trail, and we need to work more on the solidarity, because all people around the world, all good people, medical staff, students, take anyone, they support the Palestinian struggle. And the Palestinian struggle is the key anti-colonial struggle of today. And I support the armed struggle, of course, within the limits of the Geneva Convention. But don't forget that the Palestinian people have the right to resist occupation, just like the Ukrainian people have. And they are supported widely by the West, whereas Palestine is left to die. It will not die. It will have a victory at the end of this struggle. And it's all up to us to define where we stand in the struggle.
Yes. And I think it may be also important to just touch on, Dr. Gilbert, the interesting point you made once. I remember we had a discussion about how these attacks are not indiscriminate, or to describe them this way is misguided. You believe that even on the civilian population, they're very targeted.
Absolutely. Because this is the politics of elimination, which is a core part of colonial politics. And how do you eliminate a people? Well, you starve them. And the triangle of death in Gaza today, it's not merely the brutal trauma from the bombing and the crush injuries from the collapsing buildings. The triangle of death was defined to me by Dr. Youssef Abarish, the Minister of Health in Gaza, I believe it was in December last year, a year ago. He said, Dr. Mats, it's not the trauma that is the most dangerous killer now. It is the three corners: starvation, dehydration, and disease. And if you add to that hypothermia, you have an incredibly toxic mix of attacks on the human body, in particular women and children, who constitute 70% of the injured and the sick people, and the children who constitute 50% of the population in Gaza. So this is an all-out attack on the people of Gaza. It's not collateral damage. Forget it. It's not by random. This is so systematic that the only thing we can call the Israeli government is a fascist government practicing the most brutal type of colonialism. And the goal is to eliminate, to get rid of the indigenous people, the Palestinian people, which there are, if we don't stand up, they are really continuing trying to do that. And it's remarkable that after 14 months of descriptions and interviews, and we as healthcare workers, we have been shouting to the world about the consequences. Everything is known. Every piece of evidence is known. And yet, the governments of Europe and these other I mentioned, they don't care, because they don't care about the people in the global south, because they are at the core racists. A life in Ukraine counts much more to them than a life in Palestine. And what we see in Palestine is a most vicious type of apartheid and a most inhuman type of racism, in my opinion.
Thank you so much, Dr. Gilbert, for your trenchant insights, as well to each of you for your time, especially amid this very difficult
Let me add one thing I forgot to say.
Yes.
All of this could be reversed within 2 days. Number one, most important prescription from us doctors, immediate and lasting ceasefire. Number two, the second most important prescription from us, lift the siege of Gaza immediately, turn on the water, turn on the power, let the Palestinians control their own territory and have an unlimited influx of international support, humanitarian aid, medical teams, medical supplies, clothes, food, everything they need. Within this week,
yes,
the main problems could be solved. When there is a will, there is a way. A few weeks ago, more than 50 heads of states gathered in Paris, not to discuss the humanitarian disaster in Gaza, but to celebrate the reopening of the Notre Dame Cathedral. Where there is a will, there is a way. They can gather any time to decide that we will stop Israel. They don't, and they are complicit.
Yes, no question, undoubtedly. Thank you again, Dr. Gilbert. I'm just wondering, before we wrap up, Dr. Syed, Dr. Othman, Dr. Gilbert, if you have any final thoughts or observations you'd like to share, perhaps starting with Dr. Syed.
I think Dr. Gilbert touched all of those important points. I think, things that are kind of overlooked now, we've been concentrating on the trauma, the physical trauma and the injuries for so long. But absolutely what Dr. Gilbert said, the infrastructure, things like water contamination. The UN has been publishing reports for years about water contamination. I myself went out today, I looked at the sewage, and there's children playing in actual sewage. They're drinking water that's hypersalinated. They're drinking water with over 50% contaminated E. coli. And this is happening every day. That's why we're seeing children with these severe infections, gastrointestinal infections. It's not going to go away. It won't go away until that stops.
Yes, thank you, Dr. Syed. Dr. Othman.
I think that it's just to reiterate what both of my colleagues have mentioned, that even all of the healthcare workers in all the facilities across Gaza, the locals as well as the internationals have been screaming and shouting about all of the red lines that have been crossed and all of the international humanitarian law that's been broken against them. But meanwhile, they're still showing up every day to try to care for the local population here. And so, their bravery encourages us to come and stand with them and try to help support them in their struggle. But as you mentioned, as Dr. Gilbert mentioned, we need unimpeded access to medications, medical supply, support here, and an unconditional ceasefire to allow this population to be able to regrow and survive.
Okay, thank you, Dr. Othman. And Dr. Gilbert, yes.
Well, I'm just going to lift the mood a little bit by informing you that actually there has been, like everywhere in Europe and in the US, a very strong solidarity movement, and it's ongoing for Gaza and for Palestine. Very powerful. And yesterday night, our Prime Minister, Jonas Gahr Støre, came out with an unusually new, very sharp critique of Israel in a headline in the most influential paper of Norway. And he says, strong Gaza critique against Israel, totally unacceptable. I can share it with you in English, because what he actually points to are all these man-made, disastrous attacks on healthcare. But, Norway is member of NATO. We are a European country. We have been before a very consolidated pro-Israel supporter, all the major parties. But it is changing now. It is changing. And what we need is more pressure, more solidarity, more organized pressure on our governments. We can change them. We will, inshallah. And Gaza hatta Nasser, Palestine hatta Nasser, Corona Gaza.
Thank you so much. Thank you, Dr. Gilbert. Thank you all.
And be safe, my colleagues, be safe. And thank you from the bottom of my heart for all you do. And say hello to anyone you meet from Dr. Mats. I love Gaza and I love the people of Palestine.
Thank you. Thank you all.
Thank you
Thanks.
all.